Hi, thanks for joining me. Today, we're going to talk about anemia of chronic disease, which occurs when your body is fighting off a chronic inflammatory state. So there is no time to waste. Be sure to subscribe and let's get started. Alright, so before we talk more extensive, let us try to break down the pathophysiology of anemia of chronic disease in a way that is super easy to grasp and remember. Alright, so think of it as a complex puzzle with several key pieces that every examiner would like to hear. So we're going to use the medical mnemonic I chief, okay, which is easy. And we can use this to describe anemia of chronic disease in a very easy manner. Alright, so I simply means an inflammatory state. So what disorder supports this chronic inflammatory state? We're talking about autoimmune diseases. We're talking about chronic infections such as HIV. We're talking about cancer. Sometimes it can also be as a result of congestive heart failure or even renal failure as well. So this chronic inflammatory state leads to an increase in cytokines as well as hepcidin. C and H, cytokines and hepcidin gets elevated. And this would lead to, I is for iron. So there is going to be an iron sequestration. In other words, iron is trapped in the reticular endothelial system such that it is not available for the making of the red blood cells. So there is an iron sequestration in the reticular endothelial system inappropriately. Now, as a result of that, there is also going to be an erythropoiesis restriction. So first of all, the production of erythropoietin can decrease and its responsiveness in the stem cells also gets reduced. So there is an erythropoiesis restriction. And finally, there is a fall in the normal lifespan of the red blood cells because they become vulnerable and they get phagocytosis from the macrophages. So as it has been illustrated, you can see there is cytokine persistence, all right, that increases hepcidin, and this would lead to iron sequestration in the reticular endothelial system. This would lead to erythropoiesis restriction. And of course, in general, this means that the lifespan of the normal red blood cells also takes a hit, leading to a slightly decreased lifespan of the red blood cells. All right, so in anemia of chronic disease, we are saying that there is a chronic inflammatory state, okay? And this would lead to the persistence of pro-inflammatory cytokines such as interleukin-6, TNF-alpha, and interferon gamma, right? Now, once we have these cytokines, what happens is that there's going to be a cascade of events that could ultimately result in their excessive production of hepcidin by the liver. Okay, so hepcidin also gets elevated. Now, this heightened hepcidin levels will cause ions to become trapped in here. That is the reticular endothelial system. And how does that occur? So when there is excessive hepcidin regulates this channel that you see right here called ferroportin 1. So it is through these channels that iron leaves the reticular endothelial system into the blood. So once there is excessive hepcidin, what will happen is that these channels will not be synthesized. Okay, they will not be expressed on the membrane. And so there will be less of these ferroportin channels. And so the iron is going to be trapped inside here. So we are not saying that there is no iron in the body, but the iron is not in the blood. However, it is trapped inside the reticular endothelial system. So in there, the storage of iron could be in the form of ferritin. And so we could actually say that ferritin will be normal, or it could even be elevated. So regarding that, when it comes to the investigations, remember, ferritin can be normal, or it can even be elevated. But the iron levels inside the blood will be reduced because the ferroportin gates are not being expressed because there is excessive hepcidin. So that is very, very important. All right, so we have been able to explain why there is iron sequestration inappropriately in the reticular endothelial system. And this is because of the excessive hepcidin being expressed or being synthesized by the liver. Okay. Now, another important thing that I want you to know is that it is a way that the liver is trying to work, in other words, to try to avoid the inflammatory state. So it doesn't want to put the iron into the bloodstream. And this is why it is producing more hepcidin. So the liver would also not produce more transferrin, as you can see right there, right? Because if the liver wants the iron in the blood, then it will produce more transferrin. But in this case, it doesn't seem to want that. And so the production of transferrin would also decrease. And since there is a decline in transferrin levels, it means that the binding capacity would also decrease. And so total iron binding capacity in anemia of chronic disease would also decrease. Now recall, or in contrast to iron deficiency anemia, transferrin levels increases and total iron binding capacity also increases. This is the opposite of what happens in anemia of chronic disease. All right. So since we've said that, let us move on to describe what happens. So we said there is also an impaired erythropoiesis, right? As you can see right there. So the kidney's ability to produce erythropoietin declines. Moreover, when erythropoietin that is made goes into the bone marrow to stimulate these stem cells, the response is also somehow not effective. So this is also important, and this is one of the reasons why we can actually administer erythropoietin stimulating agents in the treatment of anemia of chronic disease. So if you are asked in the exam, since erythropoiesis is actually restricted, okay, what will happen to the reticulocyte count? Of course, your answer is that it will be decreased. Okay, because as a result of that, the red blood cells are also decreased. So there is an impaired erythropoiesis. And again, as we said, there is an increased hemophagocytosis. And this would lead to a decline in the red blood cell survival. So the red blood cells will somehow die prematurely, slightly. So the clinical manifestation of anemia of chronic disease is often subtle or may take the form of a mild to moderate anemia. Hence, the underlying cause of the anemia may dominate the clinical picture. Symptoms of anemia, if present, may include easy fatigability, weakness, shortness of breath on exertion, lightheadedness, tachycardia, and a pale skin. In some cases, anemia of chronic disease may not exhibit any symptoms at all. Now, regarding diagnosis, so anemia of chronic disease is a condition that requires a thorough evaluation to identify the underlying cause. A complete blood count will be very useful. You would like to assess the HB. You would also like to take a look at the mean corpuscular volume, which would show a normocytic cells initially. This may progress to a microcytic cells. Reticulocyte counts may also be declined. You may also like to take a look at the leukocytes as well as its formula. Iron levels is usually declined. Ferritin levels are high. It may also be normal. Transferrin levels in anemia of chronic disease may be declined, and there is also a decline in the total iron binding capacity. Sometimes iron deficiency anemia may coexist with anemia of chronic disease. In such cases, soluble transferrin receptors are also very good markers, and they are usually elevated for iron deficiency anemia. Inflammatory markers such as ESR and C-reactive protein are also very good indicators. Hepcidin levels may also be elevated. However, not all laboratories can measure this biomarker. So in anemia of chronic disease, you probably expect high ferritin levels, right? So let's just say you find the levels being less than 100 nanogram per milliliter, then this may actually be a sign that iron deficiency anemia is coexisting with anemia of chronic disease, because in that inflammatory state, you would expect ferritin to be high and not less. So the key point is that you have to evaluate for the underlying cause, because the anemia is secondary to the underlying cause. So once you treat the underlying cause, the anemia can also resolve. So the treatment of anemia of chronic disease requires a thoughtful approach focusing on addressing the underlying cause of the condition. While some cases may be mild and not require transfusions, severe anemia can have a significant impact on the quality of life and potentially worsen the underlying disease. Correction of anemia through erythropoietin stimulating agents such as a recombinant human erythropoietin may be effective, especially in patients with cancer. However, due to concerns about tumor recurrence, the FDA recommends avoiding these agents in patients with certain types of cancers, including breast cancer, non small cell lung cancers, head and neck tumors, as well as certain malignant tumors that are not receiving treatment. Now, in cases where anemia of chronic disease and iron deficiency anemia coexist, iron treatment may also be necessary to address the underlying iron deficiency. Now, iron and erythropoietin in combination may also enhance the effectiveness of treatment in patients with cancer, for example. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.